Today we are going to talk about AMH, that is anti-Mullerian hormone. This topic is requested by many people, so let's talk about it. Namaste, my name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Now before we continue, one important information. If you want to watch this video in Hindi language, then below in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's talk about the AMH hormone. In fact, it is a part of our Know Your Hormone series also. So AMH hormone, the full form is anti-Mullerian hormone. It is also called as a Mullerian inhibiting hormone, that is MIH. Both are one and the same, right? It is a hormone. Now the moment we say it is a hormone, the first question comes in our mind, from which gland does it come? See, this hormone does not come from any kind of a specific endocrine gland. However, this hormone is secreted from your ovarian follicles. Yes, the women who has the ovary, inside the ovaries there are tiny little follicles, and this tiny little follicle has a very special cell called as a granulosa cell. These cells secretes this AMH hormone. In fact, when these follicles, which are immature egg, which are very tiny little one, especially if their size is less than 4 millimeter, they secrete maximum of this hormone. And as these follicles grow and as the size increases, the AMH production also reduces. In fact, the sizes which are more than 8 mm, they practically do not secrete any much kind of a hormone. So that means this hormone comes from those immature follicles. Alright. Another question which is asked by many people in the clinic is that, doctor, is this hormone a male hormone or is it a female hormone? See, understand, this hormone is present in both the gender. It is present in male as well as female. However, the quantity is different. Okay, in fact, with this I just want to tell you that AMH hormone has a very different role to play, especially in the pregnancy and the development of an embryo. But practically when we talk about the AMH hormone, people understand only in terms of the fertility, and they actually don't understand the main role of this hormone. So what is the main role of this hormone? This hormone in fact helps in the gender wise organ, reproductive organ formation. Yes, you heard it right. See what happens once a fertilization happens. The fertilization is in fact a combination of an egg and a sperm. Depending on what kind of a sperm gene has fertilized the egg, your embryo will vary. If the X sperm has fertilized, the embryo will have a X gene, and that is a female fetus. And if the Y sperm has fertilized the egg, then the embryo is a XY gene, that is a male child. Alright. So what happens once the fertilization has happened and once the early pregnancy is present? Now the genetic composition is already decided whether it is a male child or whether it is a female child. If it is a male child, that means XY gene is there. In that kind of a situation, in the early pregnancy itself, the AMH hormone starts rising. This high level of the AMH hormone and the male hormone is a very important for the development of the male reproductive organs. And at the same time, it is this high level of AMH will stop or will inhibit the formation of a female reproductive organ. Yes, that means for the formation of the reproductive organ, the AMH hormone plays a very big role. If the AMH hormone level is not at its peak level and it's not on a very high level, then what will happen? The fetus, the unborn child, may not have a right male reproductive organ. They may also have a female reproductive organ, and such kind of a child, when they are born, their external genitalia can be confused, and that in medical language we call it as an ambiguous genitalia or an intersex child. That important is the AMH hormone. And if the embryo is XX gene, that means it is a female child. In that kind of a situation, the AMH hormone level will be very low and the female reproductive organs will be formed. That means for the formation of the reproductive organ, the AMH hormone is a very important. So this is actually the role of a AMH hormone. But practically we do a blood test of the AMH. So what kind of a test is it? It is a kind of a blood test wherein we find out what is the level of the AMH hormone. It is a blood test which can be done any day of the menstrual cycle. Many people have that question, which day of the cycle we can do that? You can do it on any day. And for this test to be done, you need not wait for your periods to come, or you need not wait for your any other changes in your body. You can do this test at any time of the day. Even a fasting is not needed for this test. Alright. Now let's find out what does this test indicate. See, this test is basically one of the fertility tests, and we actually want to know what is the egg reserve inside the ovary. So with that in mind, you need to also know that how many eggs are present in a female's. See, when a female child is born, at the time of the birth, inside the ovary, the tiny little follicles are nearly 1 million. But by the time a girl reaches to its puberty, this level comes down to 3 lakhs. And then out of this 3 lakhs, further and further reduction will happen, and hardly around 300 to 400 egg will actually get ovulated and convert into egg. So that means the egg reserve is a very important, and that is what we come to know by the AMH test. When do we do this AMH test? See, this testing is done especially if you are planning for a fertility or if you are planning for a conception. So many times in the pre-conception testing also we do the AMH test. Second condition is that infertility. Let's assume that you are trying for a pregnancy and you are not able to reach your pregnancy target. Then in that case, for the infertility workup also we do this testing. If you have a hormonal problem like a polycystic ovarian syndrome or PCOS, again we do your AMH testing. AMH testing we also do in certain cancers of the ovary. Many a times when a child is born with the ambiguous genitalia, where we do not know whether this is a male child or a female child or an intersex child, at that time also the AMH testing is done. Many times what happens that a female has attained a puberty age, however she has not started her monthly cycle, and that is a amenorrhea. In that kind of a condition also we do a AMH testing. AMH testing we also do in a menopause to know that whether the egg reserve is falling or it is still present. So these are the conditions where the AMH test is usually advised. Alright. Another question is that how AMH test can be considered as a fertility testing. See, basically AMH test indicates us the egg reserve in a female. So if the woman has a better egg reserve, she has a better chances of future pregnancy, and that is the reason why we do AMH testing for the fertility. In fact, in nowadays, especially the women are delaying their marriage or if they marry early, they want to plan their pregnancy at a later age. And sometimes they undergo into divorce and they want to preserve their egg for the future use. In all this kind of a situation, many a times the women opt out for the egg preservation. At that time also we do AMH testing to find out about the egg reserve. Alright, so AMH test is one of the important fertility tests. Now the next question is that what is the normal level of the AMH test? Now see, the normal level of the AMH hormone, it depends. It depends on your age and it depends on your gender. In this video, we are mainly going to talk about the AMH level in the female. Now in females, the level of the hormone again depends on your age. What happens as you age? The number of follicles which are immature just starts reducing, and that is the reason why as you age the AMH level starts falling. In general, if I have to say, then a level of 1 to 4 nanogram per ml is considered normal. But again, it depends on your laboratory to laboratory and in which laboratory, at which unit they are interpreting the report. If we talk about the nanogram per ml, then it is 1 to 4 is considered normal. Any level which is more than 4, it indicates the abnormal level. Yes, many people, especially women, become very happy that doc, my AMH level is very high, so I am very happy. No. In fact, the very high level of the AMH indicates that there is a male hormone in your body, there is an androgenic level, and this usually happens in a PCOS, and in fact it is not a good sign. Alright. So what is a normal AMH level? So see, if your age is less than 25 years of age, then the AMH level is 3. If your age is between 25 to 30, the AMH level is 2.5 nanogram per ml. If your age is 30 to 35, then your level is 1.5. And if your age is 35 to 40, the level is 1. And 40 plus, usually the level is around 0.5 nanogram per ml. So this is the age-wise the AMH level. Any level which is less than 1.4 to 1.5 nanogram per ml is considered as a low AMH level. Okay, and if your level is less than 0.4 to 0.5, then it is considered as a very low AMH level. Okay, now many times many women get disheartened when they see the low AMH level. They think that they will never be able to conceive. No, it's not that way. In fact, there are a lot of research and studies have found that even if your level are low, you still can conceive. And practically we have seen in a clinical practice also that women who had a low AMH have also conceived. So if your level is low, please do not get disheartened. Alright. See, AMH level is mainly used when you are planning for a assisted reproduction. Any kind of a procedure like a in vitro fertilization IVF or intrauterine insemination IUI or intracytoplasmic sperm injection or ICSI. When you are planning for any such kind of a reproductive technology, at that time a doctor will do a AMH test. And this AMH test is actually an indication for the doctor, not for the patient. It is an indication for the doctor that what kind of a treatment the doctor should plan. Should the doctor be very aggressive in the treatment or should doctor be conservative in the treatment? So basically it is actually a guidance for the doctor that in which direction the doctor should proceed. But yes, definitely if you have a higher the AMH, that means you have a higher egg reserve, and more the egg reserve you have a more time in your hand, and doctor can wait and can do a little slow paced treatment. But if your egg reserve is very low, in that kind of a situation, the doctor will try a little aggressive treatment. So in fact, the AMH test and their results are interpreted mainly for the what kind of a technology they should use in the assisted reproduction. Right? And one more thing is that, is the AMH level indicate your egg quality? Answer is no. AMH level does not indicate the quality of your egg. It only indicates what is the reserve of the egg. Okay, the quality of the egg varies from your lifestyle, whether you are smoking or not, whether you consume alcohol, how stressful is your life, do you have any other health problem, do you have any other kind of an issues. All those points decides the egg quality. Okay, another thing is that plenty many patients, they come and they say, doctor, please increase my AMH level, give me some medication which can increase. See, there is no rocket science. Understand that AMH is an indication of your egg reserve, and this is the egg with which you are born with. So by no medication you can increase your AMH level. But yes, with a good lifestyle and with a good vitamins, especially vitamin D, zinc, vitamin C, vitamin E, with all these vitamins, you can improvise the quality of your egg, but you cannot increase the AMH level. Alright? So that's what we talked about the AMH today. I hope after watching this video, you got some good useful information. If you are new to my channel, please don't forget to subscribe so that you get more and more health related, especially hormone related information. If you have any of your personal question whose answer you are seeking for, write that in the comment box below. I will try and answer them as early as I can. We will meet again with some new interesting topic. Till then, take care of yourself. Namaste.